So my name is Dr. Wendy Jones. I'm a consultant in clinical genetics and I work here at Chalfont and also at the National Hospital for Neurology. My background, so I'm a medical doctor and I trained in adult medicine first before going into clinical genetics. Clinical genetics is a very small branch of medicine and doctors in genetics, our role is to see and diagnose people with genetic disorders, but also counsel them and their family as the chance of other family members being affected or of the chance that their children may have similar difficulties to them or to other of their children. My role here at Chalfont is twofold. One is to help run the epilepsy genomics clinic. So this is a clinic it's a very pioneering clinic, in fact, where we see individuals with epilepsy where there's thought to be an underlying genetic cause for their epilepsy. Going back to basics, genes give our bodies instructions how to grow, how to develop, how to function. All our genes come in pairs. We inherit one gene of each pair from our mother and the other gene of each pair from our father. When we have children, we pass on just one copy of each of our genes onto each of our children. We know that some people can have epilepsy because they have an alteration, sometimes called mutation, in one of their genes. This is something that they've always had and something that they will always have. If we're able to find this change, it enables us to know what the cause of their epilepsy is. It also enables us to understand why their epilepsies happened. And it may sort of reassure us there's nothing else to look out for in the future. But for some people, we know there's also some other things potentially to look out for. And it also helps us guide the family into what the cause of the epilepsy is and whether there's anyone else in the family who may have similar difficulties. My other role at Chalfont here is to help with the pioneering genomics research that's being carried out. And we're really harnessing these new genetic technologies. And many of the technologies now, instead of in the past where we looked at just one of these genes, and we've got about 20,000 genes. In the past we used to look at one or two genes to test. But now we can look very broadly by looking across all the genes to try and find the cause of an individual's epilepsy. But these tests, they're very broad and they don't really give us clear answers. But the answers that come back are not yes or no, positive or negative, but actually lots of variants and lots of different genes which could potentially cause their epilepsy. So what do we do with these thousands of variants? Well, we have ways of filtering them down. Firstly, using a computer. And using lots of stats about the number of other people who have this variant in this gene. But actually, eventually we come down to a few variants. And the important things with these is we work together as a team, so with epileptologists, geneticists, and research scientists to try and understand these variants and whether they're causing someone's epilepsy. And so we have these multidisciplinary meetings where we discuss every patient and the variants that they have, in order to try and find out the one or two that could be causing their epilepsy. And then these findings go back to clinic. So if we're happy that they cause someone's epilepsy, the research findings get validated in a diagnostic laboratory, and then we take them back to clinic so our patients see the direct outcome of our research in clinic. And for some families, these variants could inform them about their children having similar difficulties, and for some families they might want to have a test in a future pregnancy. And so we really are here sort of pioneering research that's actually going directly back to clinic and ultimately helping our families.